So we've had limited experience in both settings. We did have a trial called the R2W trial, which was completed in the UK, and that was a Bortezomib, Cyclophosphamide and Rituximab versus Dexamethasone, Cyclophosphamide and Rituximab. And we were very pleased with the outcomes on the Bortezomib arm with good tolerability, good depletion of disease, and good progression-free survival. And that has been published. That's the frontline setting. In the relapse setting, use is relatively limited because it's not a commissioned drug, so certain hospitals can use it with an agreement. And as I say, that is some data we've just published in the EJ Heme journal, which is a good place to look for some of the details.